Hello warriors, it's Dr. Brian Mowll, the diabetes coach. Happy New Year. Today is January 1st and we're going to be talking today about how to set SMART goals. SMART goals are so important. Goals are a roadmap to help you achieve everything you want in life, whether that's good blood sugar control, a new exercise routine, weight loss, or personal success. Goals are those stepping stones that help you reach your ultimate dream. So we're going to be getting into some specifics today about proper goal setting, how to do this the right way so that you're successful. And the first thing I want to talk about today is something called the big why. The big why. You have to first develop a good understanding of why you want to achieve this goal. So we talk about this being relevant to you. And the why is so important because that's what's going to get you through tough times. You're always going to have challenges. Willpower is never strong enough to help you get through the tough times, especially a little bit down the road. The why, the reason for wanting to achieve that goal will get you there though. So that big why should be something like, I want to live a long, healthy life, or I want to see my children graduate college or have their own children. I don't want to suffer the same fate that I saw my dad go through. Maybe your father or your mother had diabetes and they're on dialysis, or had a heart attack or stroke or something horrible happened to them, and you don't want to see that same fate for yourself. Perhaps you want the freedom to be able to travel and enjoy your life. You don't want to be tied down to a medication schedule and an insulin routine if you're not insulin dependent at this time. So having a good understanding of the big reason will get you through. And then write it down, because that's going to be your motivation during tough times. So start with the big why. The next thing is we're going to do some freestyle goal setting. So what I want you to do is get a blank piece of paper and sit down, give yourself about 30 minutes or so with a pen and a blank sheet of paper, and just start writing whatever comes to mind, things that you want to accomplish. Maybe you want to lose 50 pounds, or maybe you want to lose 100 pounds. Perhaps you want to fit into a certain size dress or a certain pant size that you used to fit into. Maybe you want to read 20 books this year, or you want to travel to 3 new countries. Whatever your goals are, and don't make them necessarily realistic at this stage. Just write them down. Go freestyle. Whatever comes to mind, write it down. Even if it's a big goal that you might not accomplish for 50 years or 10 years, write it down. Maybe it's get married or have children or have another child. Whatever those goals are, whatever those dreams are, write them down on that paper. That's called freestyle writing. And that's the first step to setting good, juicy, meaty, exciting goals. Now, the next thing we're going to do is we're going to start to prioritize our goals. So now we want to go through that list, and we want to take a highlighter or circle the 10 goals that are the most important to you and the ones that you think you can accomplish first. So prioritize those top 10 goals. Go through your list. Don't throw the list away. Save that list every single year. But circle or highlight the top 10 goals, the ones that A, are the highest priority, need to be accomplished first, or the most important, and the ones that you think you can do in a relatively short period of time. Prioritize your goals. The next thing we're going to do is we're going to break those down into short-term and long-term goals. We're going to do what's called chunking it down. So let's say you have a goal of losing 100 pounds, and you want to do that over the next year. Is that realistic? Well, maybe it is or maybe it isn't. But we don't want to say, okay, I'm going to go lose 100 pounds. What's going to be easier for your mind to wrap itself around is, let's say I want to get off 10 pounds or 20 pounds in the next 90 days. So make that your original goal. We're going to take those big juicy goals and we're going to chunk them down. Let's say you want to have a family, but you're not yet married and you're not even dating anyone. So instead of saying, I want to have a family within 3 years, why don't we set a goal to get into a new relationship or to get married in 2 years or 1 year, something like that. So that's sort of how we chunk it down. And with blood sugar control, with weight loss, it's best to have something that we can reach within 90 days. We're going to set a 90-day goal. So it's still good to have the long-term goals, but we want to have those short-term goals as well. The next thing we're going to do is we're going to use the SMART goal setting method, and we want to be smart about our goals. So the SMART goal setting method breaks it down into 5 easy to follow steps or guidelines. And the first one is to be specific. You want to be very specific and clear with your goals. So when you write down a goal, it's not, I want to lose some weight. It's specific. I want to lose X amount of weight in X amount of days, which also goes into the second criteria category, which is it should be measurable. The goal should be measurable. So again, same example. You wouldn't want to just say, I want to lose weight. You'd want to say, I want to lose a specific amount of pounds, 10 pounds, 20 pounds in the next 30 days, in the next 90 days. It should be quantifiable so you can make sure you know how to judge whether you've been successful or not with that goal. So it should be specific. You wouldn't want to say, I want to look better. You know, I want to fit into my pants better. It's, I want to lose fat and I want to lose a specific amount of body fat. I want to lose a specific amount of weight in this amount of time. The next one is it should be attainable. And attainable means that not only is it realistic, but are you the only one who really has control over this? And if not, you want to look at some of these other things. Are there obstacles, for example, that may get in the way of reaching that goal? So you want to make sure that it is attainable. And if there's some obstacles that you can identify or some other people that you need to get something from in order to be able to achieve that goal, that you've taken care of that also. It should be relevant. So this is where the big why comes in. What effect will achieving that goal have on your life? Why is it important to you? Understand the relevancy of that goal to you, and that's how you stay motivated to achieve it. And lastly, it should be time-bound. So as we said earlier, it should be specific and measurable, but we want to have it time-bound as well. So when are you going to achieve that goal, or at least when are you going to reassess how well you've done in moving towards that goal? So that's the SMART method of goal setting. There's 2 other things I have here. The first is, which we just talked about, is to identify obstacles. I like to take a lot of time to really lay out any obstacles and create the solutions ahead of time, right? So I know I want to, let's say I want to eat 40 grams of carbohydrate a day. But I know that once a week, my wife likes to go out to dinner. So that's an obstacle. So what's the solution? Well, I'll get the menu ahead of time. I'll analyze it. I'll know exactly what I want to order when we go to that restaurant, right? Maybe another obstacle is I don't cook at home. Well, maybe one of the solutions is you can start cooking 1 or 2 meals at home per week. Or again, you find some good restaurants or meals at restaurants that fit your goals. So that's identifying obstacles and finding solutions. And then the last one, and this is a biggie, is seek support. We all need support. We all need accountability. We all need a friend or a family member to help us along through tough times. We're not going to stay motivated forever. Our willpower is not enough to overcome these challenges. So you need a support team. That's what we do as part of diabetes coaching is we offer professional support and accountability, help people get through hurdles, but you need daily support also. If you have a spouse who's supportive, that's great. But if not, find a family member or a friend or a coworker or another accountability partner, someone who is going to help you to stay on track when you lose a little bit of that motivation. I have a tool that I want to offer for you. It's a SMART goal sheet. It's actually a goal sheet that you can download and fill out and use as a way to not only write down your goals, but stay accountable to your goals. It'll help you identify obstacles and solutions to break through your goals this year. So you can go to my website. It's sweetlifecenters.com. There's a free resources category at the top, and just look for that goal sheet. I'll also put that resource down in the video description here on YouTube. So thanks guys very much. Have a great new year. Smash through some goals, and I know that you can do it. This is Dr. Brian Mowll, the diabetes coach, with you here today for another video blog. Remember to keep climbing and to never give up.